मित्रों, आज मैं आपके लिए एक ऐसा केस लेकर आया हूं जिसमें एक यंग गर्ल जिसको छाती में और पेट में दोनों जगह गांठें थी और उसको हमने टीबी की दवाई दी और उसकी गांठें पूरी तरह ठीक होने लगी। आइए देखते हैं और जानते हैं इस केस के बारे में कि हमने किस प्रकार से इसका डायग्नोसिस बनाया और इसका इलाज किया। आज ये मरीज पूरी तरह सही है और सुरक्षित।
Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about abdominal lymphadenopathy as the cause of tuberculosis. She is a young girl around 14 years of age and she has been having fever for last 3 months. She has lost good amount of weight, and when we see her x-ray, we find that there is a big mass on the right side in the right paratracheal region. And now she has been sent to us for the ultrasound examination. When we do the ultrasound examination, we find that her abdomen has number of lymph nodes. You can see that this is the lymph node over here. This is the porta hepatis, and this is a lymph node. This is another lymph node. This is another lymph node, and there are multiple. These are the normal vessels. This is the portal vein, and this is the IVC or the aorta. Start scanning again and go down below in the umbilical region. I find there is another large lymph node with the hyperechoic center, and these lymph nodes, they are basically non-matted and they are discrete. They are to be differentiated from the vessels by putting the color scan, because the vessels will take the color and the lymph nodes will not take the color, and the lymph nodes will have a hyperechoic center. Again, you can see that there is a lymph node which is not taking up the color, but the vessels down below are taking the color. So they are pre-aortic and the para-aortic lymph nodes. It's in the vertebral column. So they are retroperitoneal lymph nodes. Again, you can see that the lymph nodes are not taking any color. Another thing that we can do is that we should tilt the probe in the vertical direction and see if the lymph nodes, they turn into the longitudinal structures, which could be vessels or the intestines, because the intestines will show the peristaltic movement, but the lymph nodes will retain their shape and do not show any peristaltic movement. This is the fecal matter filled bowel loop, and these are probably two worms in the intestine. If I go and tilt my probe down below, I can see that there is bladder which is partially filled up. So we have a patient who has multiple lymph nodes in the retroperitoneal region, and these lymph nodes are significant in size. They vary from 3 centimeters to 1.5 to 1 centimeter in size, and these lymph nodes are likely to be tuberculosis, but the possibility of the other hematological malignancies, the lymphoma, should also. This is the spleen for this patient, and the spleen is 95 millimeters, which is nearly normal for this age, and her liver is also not enlarged. But if these two things are enlarged, they go more in favor of the hematological malignancy like non-Hodgkin's or Hodgkin's lymphoma, but they can be enlarged in some patients of tuberculosis also, and she needs to be investigated. Unfortunately, there are no lymph nodes which are accessible to the fine needle aspiration cytology, and she needs to be taken up for the tissue diagnosis by virtue of CT scan, so that the material can be aspirated and subjected to the gene expert or the other investigations to prove the diagnosis. Also be considered, and the patient should be investigated accordingly. I hope you like our video. In case you like our video, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of our friends so that maximum number of people can be benefited. Thank you very much.